Hi, it's Dr. Epstein. Again, doing with the patient, showing her 6 days out, African American patient, underwent rhinoplasty as well as a surgical hairline advancement. She's nice enough to let me just show her pictures. Now, she is just 6 days out, but you can see the early results. Anyway, her main concerns preoperatively were a rather undefined tip, a wide nose, wide base with lack of tip projection. And then on profile, she had a tip that drooped when she smiled due to pretty classic for many African American patients, a lack of tip support. In addition, she was concerned about a high hairline, so we did a hairline lowering or a surgical hairline advancement procedure. The way I approached her nose was I start with the tip. I took the tip, I increased its projection, refined it, rotated up conservatively, and secured it using a technique called the septal extension graft, caudal septal extension graft with a tongue and groove. Did not need to narrow her nostril because once I was able to bring her tip forward, no nostril narrowing was required. Sometimes it is required. I also built up her dorsum or her profile using GoreTex. Built it up around 3 millimeters, which gave her a nicer, basically a nicer harmony on profile. And I did not need to do osteotomies either. Sometimes it's necessary, and her it was not necessary. I didn't need to reset the bridge because once I built up the profile with the GoreTex, the dorsum, it looked so nice. We also did a hairline lowering or surgical hairline advancement surgery. Incisions made along the hairline, and the hairline's brought forward. Here she is, just 6 days out. Let me go ahead and show her in front of you. You can see the before, and now you can see the after. Just 6 days, she's a bit swollen. But you can see we were able to get a lot more tip definition. She's got better tip projection, and the bridge looks more narrow and has more definition and more projection because I built it up. On profile, which is really pretty on her, you see I was able to get from before. You see her tip sort of drooped, and she had a little bit of bulbosity. Got to rotate it up. It is a little swollen. This will come down somewhat. And of course, I built up the profile, the profile with GoreTex. And then the hairline, you can see that I was able to bring her hairline down by just about an inch. She'll come back at some point in the future, and we'll do some grafting to round it out. But the nice thing about the hairline advancement is I was able to bring the whole hairline forward. Anyway, she's nice enough to let me just show her results, her early results at 6 days from a rhinoplasty, as well as a surgical hairline advancement or hairline lowering surgery. Thank you very much, Dr. Epstein.